Hi, this is Dr. Matt Beal. I'm the Residency Program Director at Northwestern University. You are listening to an interview with the surgeon with the surgeon agent.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Matt Beal, Resident Program Director of Orthopedic Surgery at Northwestern. Doc, how are we doing today?
Very good. How are you?
I'm doing fabulous. Thank you for being with us.
Thank you.
Thinking about it, if you can kind of take us through your mentality and your mindset, what were your goals and aspirations during your residency, and how those changed throughout your fellowship?
I think when you're a resident, I think your goals are definitely a little bit more short-term. I think most people are in survival mode, to be honest. I don't think that you're thinking long ball most of the time. I think you're just thinking about your next call day. You just start to have to do a little bit of planning towards your third or fourth year when you're starting to think about fellowship applications and what subspecialty you want to go into. So I think a lot of your time spent doing that. There's obviously some sacrifice with that because you do spend a lot of time in the hospital. You spend a lot of time having to get letters and go on interviews, and you're running around a lot more. So I think you do end up in survival mode a little bit. So you do forget the long ball. It tends to be all short-term stuff of just getting through the whole process, which is maybe a little bit of a downfall on the back end. I think you definitely have, it's interesting. So when you graduate from residency, I always joke with the residents that you think that there's going to be like a parade outside the hospital or some applause or maybe a band. There's really not. You think the whole place is going to kind of fall apart as you leave. I can remember my last day. I handed all my stuff in, my ID, my pager, and I got the keys for my car, and I went out to the door and I checked in with everybody about, how are things going? Are we okay? And everybody's like, no, we're good. And then you just kind of leave. And I remember driving in front of the hospital thinking, well, that's done. So I think that's you kind of end up in that you do kind of move on in your head, and you tend to compartmentalize that a little bit. And then you kind of move into fellowship where you don't really know as many people. And you're trying to, make a good impression coming in the door because you don't want, you're coming into somebody else's house, essentially. The residents have been there for a lot longer than you have. And you show up and you're kind of somebody that's there that's maybe potentially competition for cases and things of that nature. So you're trying to kind of understand personalities and people and, who you can rely on, and not to mention just trying to figure out your way around. So you do kind of flip back from a space where you're pretty comfortable with your skill set and what you're doing and the people you work with, to kind of going back into that survival mode of like, I just need to figure out who people are, who I can trust. You do have a tendency to kind of do a lot of the things on your own. I do joint replacement surgery. So the running joke that I was the fellow intern because I did a lot of my own work on my own because mainly I just wanted to not bother anybody. But I do think you have to kind of spend a lot of time in that front end of really trying to establish relationships with the residents. You do have to do some teaching because I think then that helps them respect you and trust you. I think you need to be present if there's a problem and not, let them take the brunt of it. So if there was a decision that you made that affected care, you have to own it, just like the attending did. But I think you have to just be really mindful of that transition and really do it in a real deliberate fashion and really make some connections with people, because I think, same thing happens in residency. This is the whole process, if it's good, bad, or otherwise, is built on relationships. And that's really where it starts and ends. So you have to start over with that when you're a fellow and reestablish those relationships.
It's a really interesting perspective. Now, going through that fellowship year, what was your mentality heading into your first job search, and how that perspective changed in the beginning years of your career?
So I purposely went into fellowship not having a job in hand. And there are 4 fellows in joints in Boston. And I think 2 of us showed up with a job, which was interesting. 2 of which did not, and kind of had different ideas. One guy was joining his dad's practice. So he kind of knew that's what he was going to do. So he'd already kind of signed on the dotted line because he was essentially going home. Another person was going back to the university practice that they came from for residency and going back to be faculty. I came into it kind of with a little bit of a blank slate on purpose. I wanted to kind of look around. I thought I was probably going to do academic medicine because that's kind of where my brain already went to. I liked the education piece, but I wasn't entirely sure. There's obviously some ups and downs where you be in academics or go in private practice. So I did look at both sets of jobs, some of which I think my fallback was to use folks that I knew. So people in residency, my fellowship director, about jobs that they had heard of. Some I actually went through friends of mine that had actually graduated before me and now were in established practices where they needed somebody to do joints. But those jobs sat in both the academic side and in the private practice side. And I have to be honest, there were jobs on both sides that really were attractive, which was a nice problem to have, that I actually had multiple jobs that I actually thought were pretty good. I think ultimately, what drove that decision, we were, my wife and I are from Ohio. We were both Ohio State grads. So I think the thought was, well, let's try and go back home and be a little bit closer to family. And that's probably the primary component or driver for that first job was just family, which is, a nice solid place to make a decision. Ultimately, professionally, I think there were some better opportunities that I probably should have paid a little bit more attention to that made that job a little bit less satisfying for me. But the people that were there were great. They treated me really well. I was really happy with the hospital. There was just some other things that came up that, subsequently made me leave. But I think family was a nice, part of that first decision.
Can you touch on that mindset of some of the things that you were thinking about in your head that maybe weren't as ideal, but may have prevented or provided a better opportunity for you? Can you just kind of briefly talk about that?
I think when you talk about looking at two different worlds, if you're talking about the academic world versus the private practice world, there's different considerations clearly. When you talk about an academic job, it's, research requirements and teaching time, and the salary piece is not as big a part of the conversation. It's kind of, what are your responsibilities? Where are you going? Who do you have with you? It definitely focuses on the kind of the education, stewardship, teaching, the kind of the other part of it. And that's obviously set by the chairman. And that's where that conversation starts. Are there other administrative responsibilities that you're going to have to take for the department? Those are kind of where those conversations sit. When I had conversations on the private practice side, it was obviously a lot different. It's, what kind of volume do we want? What's my overhead? What's my tail going to be? How do I have to deal with insurance? What are other sources of revenue that I'm going to be able to tap into? How do I become a voting member of the practice? When do I actually start collecting that additional revenue, and what criteria are set for me to get there? And what happens if I want to leave? If I won't decide that I need to go to another practice that is either across town or in a neighboring area, what limitations do I have in doing so? So it's very different. The salary piece definitely comes up a little bit more when you're talking about a private job. But I would say there's sometimes even less wiggle there. They kind of have a spot that they want to put you in. It's kind of just figuring out, the nuts and bolts of where you need to put more energy. I think it's definitely a very different conversation.
Yeah, I fully agree with you on all those points. Can you kind of talk about what your journey was like becoming the resident program director at Northwestern?
So that was kind of the reason why I came up here. So my boss, so my chair right now is Terry Peabody, and TP was my residency director when I was a resident at University of Chicago. And then he eventually became the chief down there, and then eventually the chair. He and I, so he's one of my primary sounding boards. And I think, the best thing that you can do for yourself in your career is just to have really good mentors to bounce things off of. Because sometimes when ideas sound a little crazy, sometimes you have to bounce it off those people, and sometimes they'll tell you it's not so crazy. But I had one of those moments where when I was in Ohio, I was busy. I had a nice solid practice where I was operating, 2, if not 3 days a week, with a significant amount of volume. I had residents with me. I think my struggle points were, trying to get more involved in the department and on the education side, and trying to be a little bit more central in the residency. And some of that was just location. But I think also some of it was just where I was. I think that the idea of moving up to Chicago and being in this theater is a bigger stage nationally, and I think that helps. I think Peabody gave me the opportunity to take the PD job, which is something I really wanted to do. I actually, at that point, some of the things in academic education were changing anyway, and some of the folks that had been doing that were learning a whole new set of rules. So it was kind of an ideal situation. It was like a little perfect storm that they may have not really wanted to do that, and I was totally okay with learning it because I was going to learn it with everybody else. But I kind of wanted to put my mark on it. I wanted to build it. This was a program that had some opportunity to change it and needed to be better. And I thought I could make it better. Some of the changes that I wanted to do were not always popular. But I think that I was stubborn enough maybe to do it. I also had a chairman that believed in me and a mentor that believed that I could do it. So I got a lot of leash to change it. But I think it was just my ability to be a little bit more impactful with my career beyond just being a busy, joint replacement surgeon. I just wanted to do something else to kind of change my little piece of the world.
Now, thinking on that and talking about the piece you changed with the program, what would you say were some of the keys to your success that shaped your early career as you climbed the ranks of the academic world?
So I think for me, the thing that I figured out a long time ago, and this is not a new idea, is that I figured out pretty quickly that my career grew exponentially when my career took a backseat to other people's careers. So when I could actually make the careers of my residents and the fellows, grow, my career grew exponentially because of that. And I think some of that's reputation, that people trust you, that they then will fall back to you for advice, mentorship. It also then tends to be something that, automatically then throws you into discussions in big rooms about how do we actually do this? What's the appropriate way to educate people? How do we need to change it? Are we doing it right? Are we assessing people correctly? So it's given me the opportunity as a 40-something-year-old guy to be in rooms with people that have been doing this a hell of a lot longer than I have, asking for my opinion, which is kind of nice. But I think it's because I figured out a long time ago that it wasn't about me. It was actually about the people that were around me and actually trying to promote their career and push them. So, one of my mentors is actually one of my partners now, was Mike Stover. And, Mike said it in a meeting not long ago that, I think the best thing about our place right now is that we're pretty good at the sponsorship piece, even above and beyond mentorship. And I would agree with that. I think that that's what makes my career grow, is that I sponsor people. I push them into uncomfortable positions where they have to give talks and they have to be in front of people and they're on committees that I want them to be on, because I think it actually, it helps. So I think at the end of the day, it's about how can I make the whole thing better, not just my little piece of the pie. So that's kind of how my career, I think, has grown as much as it has.
What advice do you have for the graduating chief residents and fellows entering the professional job market for the first time?
I think some of it's just, don't make a decision too quickly. I think that it is always a fair idea to, even if you've got a job that you're pretty excited about, to look at other options and kind of compare and contrast. I think sometimes that can be a little eye-opening. I also think it's nice to have somebody that's looked at more than one contract actually look at it. So folks that are a little bit more senior to you, to look at it and decide, is this really what I should be doing? Because I think it's hard, especially for that first one, to really advocate for yourself well. I think in particular, the one that's always touchy is the finance piece. I think people just don't know where to start. I think there are some things that are in print that you can use, whether or not you want to use them or not, based on, where you're going, what the type of job is, what subspecialty you're working at, that are kind of good numbers to start with. But I think you kind of tend to undervalue yourself when you first come out. And that's maybe one of the reasons why people are somewhat dissatisfied. And that's why the 54% number actually exists to begin with. But I think people probably make a decision too quick. I think they probably need to lay back, take a long look at everything. I think they need to be inclusive of their family in that conversation. So if you have a significant other or you have children, I think that's something where everybody has to have, you have to have a long conversation with people about, what do we want to be doing right now? Where do we want the kids to grow up? Family things, are out there. You have to consider all that stuff, because otherwise you're just going to be unhappy with it. And so I think I just tell people to slow down.
So now with the pandemic this year, all these conferences have basically gone virtual. So what advice do you have for the graduating class regarding their networking and outreaching process?
So I think it's harder, right? I mean, you have to end up in meetings like this a lot of the time. I mean, it's easier if it's, somebody who's local, right? You could technically still go grab coffee with somebody and you at least sit down and have a conversation. It's a little bit more difficult when it's something where you're remote, but this is kind of what you're left with. The problem with that, obviously, is you can't see the site of practice. So I still think you want to be in this type of format as much as you can. I think eventually you do end up having to have a site visit of some sort, where you can really take a look at it. Hopefully this is kind of clearing up a bit in the next several months where people can really do that, so that they can actually be on site with those folks that they're going to work with on a day in, day out basis to actually meet them. So I think you have to use the technology that you have at your fingertips, just like this, where you and I are talking, and try and get a sense for people and try to get a sense for multiple people in the practice. It would not be an unreasonable idea to have a conversation where there's 2 or 3 people talking to you, because then you can get a sense for how those folks interact with each other. I think that's fair game. That's some of the stuff we're using right now with the residency application process this year. And I think it's the same thing that the fellowship application process is going to go through, and to a certain extent for jobs. That final step of actually being on site, because everybody's being a little careful with travel, you're kind of stuck. You kind of got to be pretty sure that's where you want to go. And then you got to take a final look, and that's where you're using that final look to really sell it to yourself. Like, no, I think I'm good with this still. So again, more time, more discussions, more people. And unfortunately, it's a lot of conversations like this versus being in person. I think, the big thing that I just tell people every year when I talk to fives, that are graduating, and even the fellows, is just to really stick close to your family and, your wife and or your spouse in general, your husband, and say, like, what do we want to do? Where are we going with this? Because I think sometimes, especially as surgeons, we have a tendency to silo up a little bit. And we have, and you definitely get in that mode with residency and having this thing that you have to accomplish, and then fellowship and this thing to accomplish, that all of a sudden you don't really have that goal anymore of something that you have to get through. It's just life. It's just take your time, really have a lot of conversations with the people that are around you, with your colleagues, so you have a sense for what you've got, to really then critically evaluate that versus the things that you think you need and that you don't have in that job. Are you actually really going to be able to attain that in the next job if you took it? Or are you going to have some level of loss? So you have to kind of really keep those people involved. So I think it's just more time, more patience, more conversations. You're never going to feel bad about doing that, just to make sure you're on the same page with the people around you.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.